Think twice, stick once. Brought to you by a team of UCSF internal medicine residents. As you may have already heard, healthcare in the United States is expensive, and every year the costs continue to climb. One major cause of the high costs is something called overutilization, which refers to unnecessary tests or procedures. Overutilization is a big problem. An Institute of Medicine report estimates that nearly 30% of healthcare dollars are wasted on things that don't help the patient. That's $750 billion in a single year. At the University of California, San Francisco, we set out to address one specific type of overutilization: unnecessary blood tests in the hospital. Blood tests are an essential part of medical care. They help physicians diagnose and treat many medical diseases. However, sometimes patients have too many labs drawn, labs that don't advance their care. How does this happen?
Meet Harry. He wasn't feeling well at home and was having trouble breathing. He went to the emergency department, where they drew several vials of blood, obtained a chest x-ray, and admitted him to the hospital for a pneumonia. Each morning in the hospital, Harry gets woken up at 4 a.m. for blood draws. Later in the day, the nurse or phlebotomist comes back to take some more blood, sometimes 2 or 3 more times. Ouch. Harry wants his infection to get better, but he wonders if all these sticks are necessary.
When unnecessary blood tests are ordered, patients are exposed to uncomfortable needle pokes, risk of getting false positive results, unnecessary procedures, and sometimes even significant blood loss. At the beginning of the 2014-2015 academic year, we set a goal: reduce the number of blood draws per patient per day on the UCSF Internal Medicine Resident Service by at least 5% over the course of the year.
We publicized our initiative with pens, buttons, and posters that featured the slogan, "Think twice, stick once." People loved it. We spread the word to students, residents, nurses, and faculty, and discussed strategies for decreasing unnecessary phlebotomy at various conferences and orientation sessions.
We also gave attending physicians a facilitator's guide to help them teach about excessive blood draws in the hospital. Our focus on the specific number of needle sticks emphasized the patient experience. We hope this would give our colleagues another reason to think twice before ordering lab tests.
Through our initiative, we asked doctors to reevaluate the need for daily blood draws in patients with stable or normal results. We also taught clinicians how to add tests on to already collected blood to spare a patient a new needle stick. We tracked our progress through our electronic medical record and gave the house staff teams biweekly feedback on how they were doing. Each team could see their progress in relation to the other teams with the hopes of building a little friendly competition and a culture of thoughtful lab ordering. This year we are working on project sustainability and expansion to include UCSF's affiliated hospitals, the San Francisco VA Medical Center and San Francisco General Hospital. We are advertising at these sites the importance of phlebotomy reduction and strategies of how this can be done. Unnecessary phlebotomy is just one of many examples of overutilization that leads to unnecessary harms and costs, both to the patient and the healthcare system. Our campaign shows that by working together and being thoughtful about our collective use of limited healthcare resources, we can put a dent in overutilization in our hospitals. If you are interested in ways to reduce unnecessary lab draws at your hospital, please let us know. In the meantime, just remember to think twice, stick once.
Created using Powtoon.